Good afternoon, everyone. Thanks for joining us for the July installment of the Clinical Conductor webinar series. My name is Tom Gaybrook, and I'll be your moderator for the webinar. Before we get started, there are a few housekeeping items we want to share. First, we will be providing a copy of the presentation via email within 24 hours of the webinar ending. Please be sure to check the email you used to register for the webinar. Also, we will be doing a question and answer session at the end of the presentation, so please submit any questions you have at any time using the GoToWebinar questions box on the right side of your screen. Today's presentation titled Patient Recruitment 101, Tips for a Successful Campaign, and will be presented by Kelsey Cushman of PatientWise. Kelly is the Director of Patient Recruitment Services at PatientWise, a full-service marketing agency for clinical trials that specializes in centralized and local patient recruitment campaigns in addition to corporate marketing. In her previous role, Kelsey worked in site selection and development for PharmaSeek, an investigative site network and sister company to PatientWise. Through both of these roles, Kelsey has gained an in-depth understanding of the industry and extensive experience working with a variety of clinical research sites. Prior to starting her career, Kelsey earned a bachelor's degree in English from the University of Wisconsin-Madison. And with that, I'll hand it over to Kelsey.
Thanks so much, Tom, for that introduction. I appreciate it. And thank you all so much for listening in on the webinar today. I really appreciate your time, and it's really muted that you all learn at least one new piece of information about patient recruitment that you can take back to your site and actually put into practice. So like Tom said, my name is Kelsey Cushman. I am the Director of Patient Recruitment Services at PatientWise. And we specialize in working with research sites on their study-specific advertising campaigns, as well as their general site marketing. And we also work with sponsors and CROs on their marketing and advertising efforts for the trials that they put on. So prior to this position, like he also said, I worked as a site selection and site development manager for our sister company, PharmaSeek. So I've definitely had my fair share of working directly with sites, directly with sponsors and CROs in many different capacities. So I do have a lot of content I'd like to get through today, so I'll just go ahead and jump right into the presentation, and then, like Tom said, we'll take a few questions from the audience at the end. All right, so first off, I just want to give you an overview of the three main topics of conversation that I want to go over today regarding things to do in order to have a successful advertising campaign. The first one is to use your advertising funds. And I know this probably sounds like common sense to some, but it's actually pretty shocking how many research sites out there don't utilize any of their advertising funds. So I'll talk a little bit about using your funds, when to use them, how to use them, and then if you don't have them, how do you get them? From there, I'll move on to analyzing the trial you're working on. So it's really important to analyze the trial and the type of patient that you're looking for before even starting to think about your advertising plan. So I'll talk about that, as well as what to do with that information when you're ready to move forward with the campaign process. And then lastly, I'll talk about design of the advertisement. So design is a super important element in making sure that your advertising campaign is successful. You know, regardless if it's an advertisement that you see or that you hear, there's always an element of design behind it. So I'll talk about different aspects of a design that are important to keep in mind when creating your study-specific ads. So moving right along, use your advertising funds. And like I said before, you know, it seems like pretty common sense to use your funds. Of course, you're not going to have a successful campaign if you don't use your funds. But actually, we did an analysis on the sites within PharmaCyc's investigative site network that spanned from 2010 and 2011. And what we figured out was that only 42 cents of each dollar that the sponsor was giving to sites in their original budget for advertising was actually being spent. So in other words, 58% of the sponsor-allotted advertising funds were not being used by sites, and those funds just went straight back into the sponsor's pocket. And I know, I mean, PharmaCyc's network, it consists of roughly 250 sites, give or take. So of course, it's not a snapshot of every site out there in the country, but it is a pretty decent snapshot of what all sites are like out there. So I think it's a pretty good analysis on what's happening elsewhere as well. So with that being said, the first piece of advice I have for any research site is to use your funds. If the sponsor gives you a budget for advertising, there's usually a reason behind it. You know, they think you need it, or at least it will be helpful for you. So definitely use it. Just as there's a reason behind why a sponsor wouldn't give you an advertising budget for a study. You know, maybe it's a very specific study. They have very specific sites in mind. You only need to enroll a few patients, and the sponsor knows that those patients are in your database. So in that case, they're not going to grant advertising funds. So if you have it, use it. There are potential patients out there that you could be missing without advertising, so you might as well use the funds while you have the opportunity. And if nothing else, if nothing comes from the referrals that you received from that advertising campaign, let's say none of them worked out for that study in particular, think of it this way. You can just put those patients in your database for future trials. Maybe they'll work for a trial in a year or two. You never know. So just think of it on the bright side. If nothing else, you can use them in the future. So I know that one of the biggest pain points for small research sites is that, you know, they don't have the time, they don't have the resources, they don't have the knowledge to spend the advertising funds and to put forth an advertising campaign. So I completely understand that. I mean, analyzing the study and designing advertising materials is definitely a time-consuming process. Also, not all research sites have a recruiter on staff, so maybe they really don't want a ton of phone calls flooding in over the course of 1 or 2 weeks when an ad campaign runs. Regardless, I do feel that it's still important to spend those funds and to spend them in the most effective ways possible, just so that you're not putting in hours and hours of, you know, creating materials, putting those materials through sponsor and IRB approvals, and so on and so forth. If you're a site out there that you just have absolutely no time whatsoever for anything to do with advertising, you want to, but you just don't have the time, outsource it. There are multiple companies out there that work locally and nationally who are experts in marketing and advertising, some of which who are experts in marketing and advertising specifically for clinical research, just like PatientWise. And these companies, typically they get better rates from media vendors just because they are a quote-unquote ad agency, or because they buy in bulk. So they're actually able to get you more for your money in that case. And the other nice thing about outsourcing is that you can actually use a portion of your advertising funds for the agency fees. So it's not necessarily going to cost you anything extra to have somebody else do the work on your behalf, which is very nice. And a great rule of thumb to use your advertising funds wisely is to try and use at least 2 media types, if not more, within your advertising budget. So you really do not want to use your entire budget on one media type because, you know, what if it doesn't work? Then your money's out the door with no return. So in my opinion, it's better to be safe than sorry and try to use a few different media types to make sure that you're reaching as many people as possible and through as many different avenues as possible. And I do realize that budgets are small from sponsors and don't always allow us to be able to do what we want with them. Believe me, I know. But if your budget does allow, definitely try to do more than just TV or just radio or just print. It will definitely be worth your while to do a combination. Also, timing is everything. You want to make sure that you don't spend your funds and schedule your campaign at just any old time. For example, if you contracted on a flu study in July, it will be worth your while to wait until flu season actually starts in the fall to actually schedule that campaign when the patients start ramping up for that. Otherwise, it can just be a huge waste of time and money for you. So just something to keep in mind, if the study you're working on does have some sort of seasonality involved, such as flu, wait until that season ramps up to actually run the campaign. I have heard stories of, sites putting a campaign out there, and of course you're not going to get very many, referrals if you schedule a flu campaign in July. So just something to keep in mind. And also, I'm stating all of this with the assumption that the sponsor has actually given your site funds up front, which I understand is not always the case. So one thing I want to mention to you is that if you haven't been given funds up front by the sponsor, try to negotiate a budget with them. It doesn't hurt to at least ask for advertising funds, and you might as well try to negotiate a budget to try to help boost that enrollment at your site. And also, if you've already used the advertising funds that you've been allotted, ask for more. You have all the power to ask for more and run another campaign. Whenever one of our campaigns ends here at PatientWise, we always, always, always go back to the sponsor and ask for additional funds. And I'd say probably, roughly, I'd say 75% of the time, we're successful at gaining additional funds for another campaign for a site. So yes, ask for funds every time. Maybe they won't give them to you, but hey, at least you tried. And I would say you might be surprised at how often you actually can get them from the sponsor. All right, so moving right along, another key component that I wanted to talk about in regards to having a successful advertising campaign is really analyzing the protocol you're working on and the type of patient that you need to come in your doors. Not all media types will work for every single study indication in every single location across the country or for every single person out there. So if nothing else, you should take into account the following items that I'll go over to determine the best media types to use for your campaign. The first one being the age range of the patient. The second one being the gender. Is it a study for males only, for females only, or are you looking for just a general population? So both. And the other thing that you really want to take a look at is the advertising budget that you've been given. That'll be a big determinant in what media types that you're actually able to use for your study. So first off, talking about age range. So like I said before, looking at the age range of the patient is super important and will help you to determine what media type you'll use for your campaign. Just as an example, and this is generally speaking, a patient between the ages of 18 and 35 will be much more likely to see an advertisement on Facebook or some other form of social media than a patient would who's between the ages of 65 and 80. And on the flip side of that, a patient who's between the ages of 65 and 80 will be much more likely to see an ad in a newspaper than a patient would who's between the ages of 18 and 35. So not to say that there will be 0 people between the ages of 65 and 80 to see an ad on social media. That's not the case at all, but we're just talking, generally, and majority's rule here, that the majority of people on social media will be in that younger population. So like I said, age range will be a big determinant in what you decide to actually use to get patients in your door. Gender. So for your study, are you looking for male patients, are you looking for female patients, or are you looking for both? The gender of a patient is also a big determinant in the media type you decide to use. As an example, let's say it's a study for males only, and you've decided you really want to use TV, and you have a significant budget for that, which is great. Well, if it's for males only, you're really going to want to place your ads on stations such as ESPN or the Golf Channel. And on the flip side of that, if it's a study for females only, you'd really want to place your ads on stations like TLC, HGTV, the Food Network, so on and so forth. And what would you do for a study that's looking for just a general adult population for both males and females? For those, news stations are a big hit, primetime shows. Although those are a lot more expensive, and it does depend on your market, but across the board, those are a lot more expensive to get. They are effective. So it might be worth your while to spend the extra money to get those types of TV spots. And the same thing goes for radio and print. I mean, there's certain publications and radio stations out there that are geared towards one specific demographic. So choose the ones that best fit who you're trying to look for. And diving even deeper into this, if radio is being used, you'll want to use a male's voice if you're trying to find male patients, and you'll want to use a female's voice for the voiceover if you're trying to find female patients. And for pediatric trials, typically women's voices are used in order to reach out to the mom population. Again, disclaimer on all of this that we're talking majorities rule here. So, even for the TV ads, I'm not saying that, no females will see ads on ESPN, but more males will. So that's all I'm saying, is that majorities rule, and we're just kind of speaking in a general sense, which is what you want to do for your campaigns as well. And the last portion of this section I want to talk about is analyzing that advertising budget that you've received. So the amount that you've received from the sponsor, in my opinion, is going to be actually the biggest determinant in what media type you'll be using for your advertising campaign. If your budget's somewhere between $5,000 and $7,000, which in my experience is on the higher end from the sponsor, I have seen budgets higher than that, but it's more rare for that to happen. So between 5 and 7 is probably the higher end. You probably, depending on your market, have a pretty decent TV campaign with that type of budget, and you could also throw in, some print ads, digital ads, radio ads, whatever mixture you come up with there. If your budget's between $3,000 and $5,000, which in my experience seems to be kind of the norm, you'll for sure have a decent budget for radio, along with a few other components like social media or digital ads, print, just making sure that you do a good mixture so you're reaching out to as many people as possible. And then anything below $3,000, obviously you're much more limited as far as what you can do, but if you wanted to go with radio, you probably still could, but I think a majority of your budget, if not all of your budget, would then be put towards that to get a decent campaign. And like I said before, we really want to steer clear of spending all the funds for one specific media type. So you could, look at radio rates, but digital will be a great option along with print. You could probably do a mixture of that. But again, all of this is completely dependent on your market and pricing from the specific vendors in your area. All right, and then the last portion of the presentation I wanted to go over with you all is the design of an advertisement. So having a good design is key to having a successful advertising campaign. There are three main areas that you'll really want to make sure you cover when creating an advertisement. The first one is that you want the advertisement to be eye-catching. The second one, you really want the advertisement to be very clear and very informative to anyone that's looking at it. And then the third one is that you must have the advertisement be aesthetically pleasing to the eye or to the ear if it's a radio ad. So here I'm showing a couple of examples of a print ad for a bladder cancer study. The one on the right is one that we actually created. I couldn't put the site logo there, but that's one we created, and the one on the left is just kind of a mock-up of what a poor example would be of a print ad. And believe it or not, these types of ads are out there. So I'll kind of go over each of the items I had just listed, what's really great about the one on the right and what needs to be improved on the one on the left. So first off, the advertisement must be eye-catching. So having the study indication really large and bold will help to create an eye-catching ad for anybody out there. Even if somebody doesn't themselves have bladder cancer, maybe their grandpa does or their mom or dad. You never know. So, you also have to think about, the word of mouth type things that can come into play. You also want to have a good layout so that your eye travels throughout the ad and not just at one spot in particular, or your eye just doesn't really know where to go. That's what happens to me when I look at the ad on the left. I just don't know what to look at because there's not really a clear direction or one specific thing that pops out at me. The ad on the right, however, it's very clear at the top, have you been diagnosed with bladder cancer? That's, bold and big. And then the way it's laid out, there's the blue background at the top, and then your eye can travel down towards the blue box at the bottom, as well as kind of making sure that the colors are scattered throughout, just so your eye just kind of goes from top to bottom, and you're not kind of looking all over the place. So definitely a good layout is something that you want to make sure you have. On top of that, you want your ad to be very clear and very informative. So giving the patient a clear call to action with contact information listed is extremely important. So a phone number especially, or if you want the patient to go to a website or a study-specific landing page, that would be an option as well. So the ad on the right clearly shows what the patient needs to do. If you are interested, call this number, and then there's also the bladdercancerresearch.com at the bottom. So it's very clear. You'll also want to make sure that you have enough content included so that the ad is informative, but you don't want to have too much content included so that the ad doesn't actually defer people away because there's too much text, confusing inclusion and exclusion criteria, and just too much going on. So the ad on the right is very informative. It states, 4 bullet points of what the participants must do or must have in order to participate. The ad on the left, on the other hand, it shows a phone number, but it's not very big and bold. It does have a clear call to action, actually. It says call to see if you qualify. But there are no inclusion, exclusion type. I mean, you could get calls from anybody from this ad. And you don't even know who you're calling. There's not even like the site name or anything included. So it's just, it's just not a good example of something to put out there. Another thing that I don't want to forget to mention is that if a patient would receive any sort of patient stipend for participation or reimbursement for travel or study medication, any incentives are great things to include in your advertisement to further draw people in. So the ad on the right, that blue box towards the bottom says qualified patients may receive study-related care and study medication at no cost. So those types of things can be the deal breaker for somebody to pick up the phone and call. So if that is included in your study, if any sort of incentive is included, make sure it's on the ad because guaranteed you'll get more calls that way. And lastly, you want to make sure that the ad is aesthetically pleasing. You'll want to use colors and fonts that go well together, nothing too bright or jarring, and nothing too dull or boring. So the ad on the left is black and white. That's pretty dull and pretty boring. The ad on the right, when we had the site logo included as well, it actually went very well with this color scheme. So we made sure that the site logo actually matched with the rest of the ad too. And speaking of the site logo, that's actually a great idea to include in your ad as well. It's not 100% necessary, but it does add site credibility, which is always a positive thing. You know, you could always just list, you know, local doctors at XYZ Clinical Research are conducting this study. That's fine, but I personally, if I saw an ad with that versus an ad with that plus the site logo, the one with the site logo I would trust more, and I would want to call before the other one. So just something to keep in mind, having a site logo is important, and including your site logo on your ads is important as well. So that pretty much wraps up the presentation. I'll just turn it over to Tom now, and we can do some question and answers. But again, I want to thank you so much for taking the time and sitting in on the webinar. I really do hope that you learned at least one new thing and that you can bring that to your coworkers and put it into practice.
Well, thank you, Kelsey, for the excellent presentation. Now we'll move in, of course, the question and answer portion of the presentation today. We'll start with one. Many IRBs will not approve ads with compensation. In fact, I got a response this week that required me to say you will not be compensated for this study, even though there was a stipend. How do you deal with something like that?
Unfortunately, IRBs have the say. So if they don't allow it in the ad, then you can't put it in the ad. It's as simple as that. I wish there was a way around it, but you have to do what they want.
Okay. Another question, would including incentives on an ad be considered coercive, especially from an IRB point of view?
That's a good question. You know, if the IRB approves of it, I think it's fine to include. And to be honest, we include incentives as much as we possibly can. So yeah, I think it's fine if they approve it.
One of the web folks says, what about FDA guidelines for adverts?
I'm sorry, can you repeat that?
What about the FDA guidelines for advertising?
Well, of course, you should always go by FDA guidelines, and if anything wouldn't be approved by them, I mean, the sponsor and the IRB, through that approval process, they make sure that all of that is taken care of. So make sure that you get your ads approved by the sponsor and the IRB, and if they are approved by the sponsor and the IRB, then you're completely 100% good to go.
Okay, another question. The viewer says, I work for a site that does a lot of COPD trials. Do you have any specific patient recruitment methods or media types that have worked well for this indication?
That one, it's a pretty tough question to answer because regardless of the indication, a lot will depend on your market as well as the study requirements as far as, what the best media type would be to use. Lately, we've been having a good response from digital media and social media for COPD. I'm just thinking of a couple studies in particular off the top of my head. And unfortunately, I can't really get into specifics about what companies and vendors we use for digital media, but I have to answer pretty generally to this. But again, that might not work for every single COPD study and every single market out there. So yeah, it's kind of tough to answer. That's the tough part about advertising, is that there's just really never any guarantees. So that's kind of one of the biggest hurdles we have.
Okay. Another question, they recruit in a local doctor's office. Do you have tips on how to approach the potential subject? Like, what is the best way to introduce the study and encourage people to participate face-to-face?
Yeah, if they come into the clinic, we've done quite a few brochures. You can do posters for clinics. I know that we've worked with sites who they have the brochures in the office ready to go, and if somebody they think is going to qualify, they introduce it to them that way. Obviously no pressure involved, but just kind of more of an informative type discussion versus, you need to do this. Yeah, those types of print ads really work well, and it's one that would be less expensive just because you're not actually utilizing a vendor for it. You really just have to print the materials that are approved. So yes, that would be, in my opinion, the best route to take.
Okay. Another question, would flyers that list your active trials require the IRB approval, especially when it might involve more than one IRB?
No, so you can list the active trials at your site on your ads. You just can't list any specifics about the trials. So we've done quite a few flyers for sites. On one side, it'll have a specific ad that we've gotten IRB approved, and then on the other side, it will actually promote the research site. And in which case, a lot of times they'll just list, these are the active studies happening. As long as there's not a protocol number, if you just state the general indication, COPD, asthma, type 2 diabetes, so on and so forth, you do not need to get that IRB approved.
Another question, have you had trouble with Facebook advertisements specific to an indication? Our site has been denied advertising, they say, on Facebook in the past. We were told that migraines were exploitive and were isolating to groups, so they said no to advertising.
Yeah, Facebook is interesting. To be honest, Facebook's tough to advertise on for anything clinically. You have to be very specific. The pictures you use have to be very specific. So there's a lot of guidelines Facebook has that I would kind of brush up on before even starting to try to do a campaign with them. They definitely do have a lot of hoops to jump through, but any Facebook ad we've done, we've had pretty decent success with. But in terms of getting the ad out there, it can be tough sometimes.
Okay. Another participant says, we are located in a small-sized town, under 50,000 people, and we don't have any local TV stations, but we have done network TV ads for stations 50 miles away, and they mentioned that you recommended ads on channels like ESPN, HGTV, etc. How does one go about placing the ads?
Sure. So you can use different vendors to place the ads, of course. That's actually what we do. We work with a specific vendor who specializes in placing the ads, and honestly, if you have no experience whatsoever with placing the TV ads, I'd search for a vendor to do it for you. There are a lot of intricacies in that, way too many to go into over this webinar, and you can ask me offline about that too, but that would be my biggest piece of advice for you, is to find a vendor who specializes in doing that.
Another question, do you have any tips on how to negotiate additional advertising funds with the sponsor?
Absolutely. So the first thing I always do is go back to the sponsor contact and ask if gaining additional funds is even an option. And if so, what information do they need in order to process a funds request? That way, if it's absolutely not an option, then you don't waste a bunch of time putting together an additional funds request proposal for them. If they come back and say that, yes, definitely you can ask for additional funds, typically they'll list out the things that you need to present to them, such as, how much money are you looking for, what campaign did you run already, what were the results from it, and what do you plan on doing for this second campaign. And there might be more questions they ask as well, but generally speaking they'll ask something along those lines. And then from there you can actually create a formal advertising funds request proposal that really spells everything out for the sponsor. And to be honest, you'll most likely have a better chance gaining those additional funds if you put a little extra time and effort into making the proposal versus just writing it to them in an email.
Okay, and yes.
Yes.
We have our last question. The participant says, I have a $3,000 budget for a pediatric asthma study. Just wondering how should they spend the money to the best advantage to reaching the most people?
Good question. Like I stated before, a lot depends on the study parameters as well as your market. But with just the general information of a pediatric asthma study with that budget, I would probably use a portion of the budget with radio and a portion of the budget with some sort of social media and digital, probably digital banner ads. Digital banner ads are actually pretty great because you zone into specific demographics. In this case, you probably want to zone into the mom population, and within a certain radius of the research site. So you can do that with a lot of different digital social media campaigns as well.
Okay. And with that, just a reminder that the slides will be sent out via email within 24 hours after today's presentation. Thanks to everyone for attending today's webinar. We hope you found everything very interesting and informative, and a big thank you again to Kelsey for presenting. And be sure to be on the lookout for the next installment of the Clinical Conductor webinar series.